sure it's 80 degrees and perfect weather today. He runs a very impressive pain-free clinic there, and he provides their Chinese medicine as well as postural corrective therapy, laser therapy, and functional medicine. He consults with many people on how to integrate postural-based exercise and functional medicine into their practices. So how this will work today is Dr. Dillberg will present a case study, and then he will present the signs and symptoms. And then he'll leave a little bit of space for you to think about whether there was more information that you might want to gather from that patient. And so you can post those comments in the chat box, and I'll read those to Dustin, or he can read them. And then from there, he'll present more information, maybe answer something about the questions you've posted, and then we'll challenge you to also present your diagnosis of the patient. After that, he'll go into his rationale and the various treatments that he applied to the patient. We expect this will take about 45 minutes to maybe 60 minutes at the most. Both Dustin and I have to leave at exactly noon Pacific time. So that will provide a limit on what we can do today. We will post these webinar on our blog and on our YouTube website. So really, Dustin, thank you so much for coming today. I really appreciate your time and your generosity, and I'm sure everybody attending will do that as well and appreciate your knowledge. So without further ado, I'd like to turn it over to you, Dr. Dustin Dillberg.
Thank you so much, Jack. It's a pleasure to be able to come together in these wild times. There's so many good things that are happening in the midst of all the chaos. I hope all of you guys are happy and healthy and safe. And it gives us an interesting time to reflect and kind of come together with opportunities for new learning. And so really excited to share some stuff with you guys today. This case study has a bit of a purpose to look at some of the integrative aspects of our medicine. I love when it's appropriate being a purist and utilizing one and only one therapeutic modality. But to be honest, it's not the way that I usually work, because I've seen the synergistic effects of our medicine just multiply the results quite a bit. And so today we're going to be going through a shoulder pain case. I want this to be interactive. I have my chat box open. I want you guys to, at the appropriate times, really pour in some of your ideas and questions and answers to my questions. So please get ready to participate. We're going to jump in. So this is a 40-year-old male with right-sided shoulder pain. This gentleman is a fitness pro. He has great muscle tone. He's in incredible shape. He describes his pain as right shoulder capsule pain, about 5 out of 10. He feels tight and restricted. It has been increasing for the past 3 months or so, with no direct injury to blame. I'm presenting this in the same way that he presented it to me. So there's going to be information that unfolds at different times, as you know, as we work with our patients. Not all the information is on the intake sheet or quickly presented to us. We have to pull it out of our patients, and this is one of those types of cases. He reported that the pain increases when he's sleeping, especially on his right side. If he lays on his right side, the pain increases quickly, and also with any sudden movement, with any like reaching into the back seat type of movement, trying to go into any internal range of motion. Pain is quickly present if he goes hands up overhead. In some positions, shoulder pain will radiate down his right arm, and he uses a leave as needed for his pain. Digging a little deeper, I asked him if he had ever had other issues, and came out that in 2009, he had a slip and fall on ice and landed on his right arm. He did hurt his right shoulder, but that was over a decade ago. This case is current. I'm continuing to treat this case. It's a brand new one. His injury, however, was undiagnosed. He saw a doctor, but no confirmation or MRI was done. Basically, he had it in a sling for quite a while. He was told that he just needed to let it heal, and it started to after about a month or so. He had a cortisone shot in his right elbow after this. He didn't remember the date, but he thought it was maybe 2 or 3 years later. He started having reoccurring elbow pain. He ended up getting 2 rounds of cortisone injection. And he laughed at himself, and that he said, yeah, of course I got the injection, and I went back and hit it in the gym. Secondary complaints include rhinitis. He uses Flonase nightly. and he kind of brought this up as it wasn't a big deal. It's been lifelong, very secondary. But as we continued to learn more about his case, it's quite a serious case. He's suffered from it his entire life. At the age of 10, his doctor finally had enough of trying to manage his symptoms and removed tonsils and adenoids. Unfortunately, it didn't help. He continued to have more and more issues. It is so bad that he's unable to sleep. He feels like he can't breathe. He has such congestion in his sinuses, and it really does affect his breathing in other aspects of his life as well. He also has some low back pain, 1 to 2 out of 10. It's on his right side, QL SI joint. So right shoulder, right low back. Don't take the symptom. What's his lifestyle like? He honestly lives a pretty cool and exciting life. He's a really interesting guy to talk to. He travels frequently. He's very passionate about it. He has a ton of different hobbies. He loves to make his passions his work. So he is a fitness pro and he's also a photographer. Any idea in the chat box as to why the photography could be of interest to me? I'll continue. Admits to not always taking the best care of himself. Exactly. Holding the camera. Chemicals, that's a good one. But getting down and postural is what I was looking for. He feels shortness of breath and difficulty slowing his breath with many movements. His aura ring he brought up, partially because of his poor sleep. He's interested in the difficulties of his sleep and how his aura ring, he's embarrassed of the results. He only gets into deep level of sleep about 10% of the time. And he is frustrated as can be trying to body hack different aspects of his life, but his heart rate variability, his HRV is very low, down in the 30s, and he has an incredibly difficult time. He can't get it to budge. Any ideas as to why that might be something of interest? Family history. His mother's side has a ton of hypertension and cardiovascular issues, a number of strokes on her mom's side. Her dad's side, his dad's side, asthmatic COPD. Any ideas on the HRV? No, his family were not smokers. Getting into some of our TCM questions. Temperature reported as normal. He sweats a bit easily. Now he comes from a really warm climate, actually a very tropical climate, more so than even Hawaii. He's used to being hot, and so he drinks liquids throughout the day. There it is. Zhangqi vacuity, lung shu. Adrenal stress as far as the HRV. Now he always drinks fluids throughout the day because that's how he was raised. So he literally feels anxious if he doesn't have water in his hand. His energy is pretty good throughout the day, but has to have coffee. You take away his coffee, he is not going to be a happy camper. He rarely naps. He feels like when he naps, he wakes up more tired than before. Sleep is chronically poor due to his breathing issues. His appetite, digestion, and elimination are all good, and he eats very clean. He reports no headaches, eye issues, or ear issues. We talked about his sinus issues. They are worse at night. His tongue was mildly dusky, just a little bit on that purple side. Not overly red, if anything, just a tinge pale. His pulse was really tight in the middle position, weak in the first and thirds. So to answer more on that heart variability, yes, adrenal burnout from a biomedical perspective, HPA access, exactly, Greg. When your heart rate variability is not fluctuating, we want a high heart rate variability. We want it to be able to change the rate in which it beats. And low heart rate variability is related to chronic stress, constant level of stress that your body's not adapting efficiently to. So now I pose this question: what do you want to ask him? What additional information are you looking for? Eye ear issues? Not at all. He reported no issues, eye and ear. And we're being asked to make it so all panelists and attendees can see your chats if possible, if you're okay with that. No reported PTSD. That's a great question. Just a couple more seconds to get those questions in. Bowel movements, elimination was great. Urination was great as well. Besides a leave, what makes it better? Like when he's not moving, he's not in much pain. Did not get into any grief work. That's a good idea. He drinks his coffee warm. I actually know that one. I did not get into libido. Good question, Greg. Those are great ideas. The other prescriptions, he's on Flonase nightly just to help him sleep. Sometimes he'll wake up 2 or 3 times in the middle of the night, hit another shot of Flonase and go back to sleep. HPA axis is pituitary adrenal function. Sources of stress. Good question. What his downtime, his relaxation looks like, childhood abuse. All right, keep those coming in. We're going to continue to what do you think his TCM diagnosis, with the information given, what do you think his TCM diagnosis is for this case of shoulder pain? He does not drink, actually, any alcohol. Good question. He says he might have 2 drinks a year. All right, we've got diagnoses coming in: Taiyang meridian, qi and blood stagnation, lung shu. I like that one. Kidney shu. My diagnosis on him was liver qi stagnation and lung qi deficiency, mild underlying heart and kidney shu. What type of tests would you like to run? Remember, this is an ortho case. What do you want to look at physically? Range of motion. Good job, Deborah. And Scott. Straight leg raise test. There we go. Thinking outside the box. RTC, scapular glide. Qi stagnation in the chest, Taiyang, as far as diagnosis. Good job, Susan. Yes, it's a local stagnation with an underlying deficiency. And so continue to put your tests in the chat box, please. What I'm wanting to do is explain how our office works. The way I practice is sometimes referred to as a little outside the box. It's looking away from the site of pain commonly. And so yes, we're for sure going to want to palpate the shoulder, for sure take the range of motion, but first and foremost, I always do a posture check. The big picture comes first. If he's coming in with a really skewed posture, fixing the localized injury rarely answers the question as to why he had the injury occur at that site, especially given that it wasn't that he just fell on it 3 months ago. He's dealing with something that is a repetitive use injury. His body is using his shoulder incorrectly. And so looking at his posture, this is my posture diagram that came off of the ePEAT software, the Egoscue software. He had a very depressed right shoulder. In fact, looking back at his like photos that he posts online, he all of a sudden started going, my right shoulder is always so much lower. I'm always kind of in this dropped position. It's interesting. He has an elevated right hip. His right hip, as I move this, just so I can see my slide a little bit better, is pulled back or posterior. If you look on that far right pane, that top pane, you're going to see that his right shoulder is forward, his right hip is back. He has a counter rotation throughout his torso. His knees and feet both are reverted. He has a pelvic tilt on that right side as well. His right shoulder is internally rotated. Something that this posture diagram can't show you is that his shoulders were actually very far back with an internal rotation. And so his scapulars are very retracted, which is incredibly rare in this day and age. We almost always see everybody rounded and collapsed in their thoracic spine. He actually is, because of his physique and his bodybuilding background, he has a very pulled back shoulder, high chest position to a fault. Combo that, which is going to pull really tight through this anterior shoulder, and an internal rotation deficit at the humerus, it's very compressive through that shoulder. No serious scoliosis. That's a chat comment. No serious scoliosis, but definitely some lateral curve, which the diagnosis of scoliosis is lateral curves through the spine. Almost all of us have a certain degree of those. The second thing I look at is breathing. I believe breath is one of the most underutilized ways to diagnose or assessments, especially in this case. His sinuses, his background with poor breathing habits, anytime we're looking at, honestly, any type of pain, I want to see how well and efficient they're breathing. That, along with one of the chemical tests I use, which is omega-3 index, it tells me how fast they're going to be recovering. And so looking at his breath, he was very much so an elevating chest breather, but his back was incredibly tight and compressed. And you need to be able to breathe into your back. His gait and lifestyle movements. I look at the way people walk. I want to see how his hips are functioning, how his I say rubber meets the road, how his foot contact, heel contact, pushing through his forefoot or toes. What does his gait look like? And while he is walking, what is his shoulder function doing? Where is the instability? What is he compensating for? Once we go through the big picture work, then we get into shoulder range of motion. I wanted to see how his body would move in the big planes of motion, internal, external rotation, all of that. He was very deficient, had deficits in his internal rotation, powerful deficits. But quickly, I went to, what does his cervical flexion extension range of motion look like? Why is that important? His neck, as he would look up and back, his right side, he would collapse to his right every time he went forward and back. Take a look at that chart, 7.7 from Matt Callison's sports medicine and acupuncture book. Those nerves that exit the spine, if they are compressed and irritated on that right side, they're obviously going to create issues, both functional and sensory issues on that side. And so quickly I realized that yes, there's definitely some nerve root impact, there's some impingement, there's some issues going on above the shoulder that will have some major impact on his shoulder function. Next, I took him through some hip stability tests. Two of my favorite hip stability tests, I'll quickly just explain to you. I have them stand pigeon-toed, roll their hips inward, so they're pressing their knees together. It's basically like a standing decompression type of posture from foundation training. I have them posture up and allow for their body to adapt to a artificial stabilization of their hips with internal rotation. That is excellent for SI joint pain. Now, as he went into that, he was able to move his shoulder overhead without pain. What does that tell us? The second test I had him perform was activating his glutes with his feet pointed straight ahead, activating his glutes to see if there's external stabilization that could be beneficial as well. And again, he was able to move with less pain, greater range of motion, definite improvements as we stabilized his hips, both with internal rotation and external stability. The shoulder commonly stabilizes for the hip as we're walking. We are cross-crawl pattern humans. As we put our right foot forward, our left arm should go forward and vice versa. If there's an instability on one side, we commonly will start to activate shoulder compensations. You can easily visualize this with someone who's severely sprained their ankle. You hobble and you start to actually walk with your upper body a ton. This can create headaches, neck pain, shoulder pain from a sprained ankle, which doesn't really show itself as a major symptom until the pain in the ankle is gone and we're able to focus elsewhere. And so definitely looking at hip connections. The shoulder specific tests, you listed a ton of them. We went into palpation, found adhesions, major adhesions, especially stomach 13, 14, pec major, minor, motor points and trigger points. They were balled up like crazy. His trap was incredibly tight as well, but stretched long and tight and in spasm. His splenius capitis, occiput on the right side, very, very tender. He was sensitive at SI 9, 10, and Jianho, the posterior shoulder. That's where he's experiencing most of his achiness and capsule pain. And he was incredibly puffy through his collarbones and sternum. Anybody know what that's a sign of? It felt spongy, extremely puffy. The Ruse test for thoracic outlet syndrome, he not only had neurological symptoms on that right side, but he also had a clear between his right and left hand. One hand was blanched, looking like it didn't have any more blood in it. The other hand still had regular coloring. Yes, coming back to clavicle sternum, if that is really spongy, tender, puffy, lymphatic backup, lymphatic inflammation. All right, Ortho Diagnosis. I won't get into all the other tests that we've done. Honestly, in clinic, you need to be really good and quick with your ortho testing, because honestly, I normally don't have time to take people through 25, 30 ortho tests like it commonly says in the book. We were able to identify some major issues, and I wanted to get them treated on the very first day. And so definitely C-spine involvement. Thoracic outlet syndrome would be what I would basically name his orthopedic diagnosis, but can't forget about the C-spine. External rotators are very short and tight. He could not get into internal rotation without pain, and his range of motion was very limited. His external shoulder, specifically teres and infraspinatus, they were just strained because of the retraction through the rhomboids and internal rotation at the humerus. We found the complicating factors of hip instability. His breathing component was definitely of issue. Probable mild labrum tear. There was a little bit of clicking and movement, bursitis, rotator cuff imbalance. I noticed that things are rarely, especially in cases like this, it's rarely one thing and one thing only. So we want to treat the whole condition. I feel like labrum tears are not always needing surgery. Actually, most professional like pitchers, baseball pitchers, if they are assessed, they have labrum tears with no pain and high level of function. And so not that it's ideal to have a torn labrum, but it's not something that I would immediately refer out for surgery, see how much improvement we can get, and commonly get great improvement in clinic. Mild bicep long head tendinopathy as well. When patient is experiencing pain just trying to reach underneath the opposite armpit, commonly indicates that bicep tendinopathy, and he experienced that as well due to the shoulder imbalance. To show you some of the nerve conductivity and the muscles that are involved, he has some brachial plexus components. This is part of his flexion extension imbalance, right to left side, as well as the neurovascular component. That thoracocoricopectoral tunnel is a major area that is going to be one of the hardest parts of treating this case. He is incredibly locked up with scar tissue and adhesions right through that area of the blue circle there. Again, these pictures are from Matt Callison's Sports Medicine Acupuncture book. It's an awesome book. I highly recommend every single one of us has that on your bookshelf. So treatment plan. We have recommendations for hands-on treatment 1 time a week. Hands-on treatment is what I call the work that I do for people and on them. The hands-off treatment is what I do to recommend lifestyle changes, teach them corrective exercise, all the things they can do without me. I call my hands-off sessions, hands-off treatments. Posture and corrective exercise prescribed for daily use, change and add as needed as we go through. We got herbs and nutrients and lifestyle enhancements. I'm going to treat this physically, chemically, and emotionally. My hands-on treatment, first thing I was doing since his neck was showing the signs and symptoms that he was. I had my Erconia laser with upregulation cycles on his cervical spine, right on the Du and Huatou lines. This initial aspect of treatment works wonders, incredibly effective to change the ability of the body to adapt and adopt the changes in treatment, as well as holding them. After upregulating the spine, I usually go through stomach 9 scalings, especially with a case like this, with vagal nerve toning, helps to relax the spasms, get the breathing cycle to change. That's been shown to help with heart rate variability as well, helping to relieve some of the inflammation and compression on the brachial plexus. Then as I'm doing other therapies, throw the laser up on the scalp motor line for the upper extremity, and can also use it over our other TCM therapies, right over the needles, while we're gua shaing, over cupping or through cups. And then as I'm working on the end aspects of treatment to help lock in the effects of the hands-on treatment, I usually will laser over the cerebellum. Notice that this is powerful to extend the life of the treatment, allowing them to hold the changes for longer, especially after corrective exercise. In addition to the light therapy, we were doing Twi-Na, the cervical spine, have them lay down on their back, have them go through just gentle range of motion, just identifying where the adhesions, where the resistance is, doing some soft tissue work to re-educate some of the muscles. So some of this is called myofascial work or active release, trigger point, motor point, hands-on work. I was working on his occiput, just trying to free it up, see where are we able to make the greatest amount of change, what is the most stubborn, where we need more therapy or less therapy. And so I use this initial aspect of the treatment also diagnostically. And we're able to find that his first rib, because of his position, was actually superior to where it should have been. You can feel the first rib tension underneath that trap, and you can feel it through the scalings. As we have him go through range of motion, active range of motion, while tacking down that trap, he's training his scapula to move and glide more effectively. After holding that trap down and releasing the pec at the same time as he's just doing front raise, he was able to move his neck far more effectively with less pain and tension. We got into some of the restrictions and range of motion, not only at the cervical spine, but at the shoulder. And we started doing some acupuncture. His baseline acupuncture prescription that I was using, in addition to his motor point and more localized treatment, was Ren 17, Do 14, gallbladder 20 and 21. On his right side, using lung 9, lung 1, and P6. On his left side, using stomach 38, liver 3, and gallbladder 34. Motor points. If you guys have Matt Callison's book or workbooks and have been to any of his trainings, you'll know about these motor points. They're incredibly effective. They've been described as like hitting little reset buttons for our neurological system. When you hit the trigger point properly, which is the point where the nerve innervates that muscle tissue, it sends that clear communication line to take a muscle that's in severe spasm and help it to relax, something that's flaccid and not firing properly, get it plugged back in. And so it works fabulously. If we're talking about this specific case, we hit stomach 14 on that right-hand side. You can see the pec major clavicular point. This is powerful because he had literally what felt to be like a quarter-size nodule there. It was just incredibly bound up, tight tissue. It did not feel like a lymph node. It felt like a muscle spasm with scar tissue. We hit up his pec motor points, his trap motor points. We had, while he was in a seated position and working on these motor points, I had him sitting while doing knee pillow squeezes. Had him doing the foundation training sitting decompression position. This is to help connect the hip stability to the shoulder function. So neurologically, we have him stabilizing his hips while his body is able to let go of some of the compensation tightness in his shoulder. Had him going through range of motion after I pull some of these points, shoulder and neck, with fantastic quick results. We had, for the posterior aspect, the posterior trap. We got into the deltoid. I love working teres, lat, SI 9, 10, the extra points in through this posterior shoulder where he was having a whole bunch of irritation and sensitivity. The infraspinatus and supraspinatus trigger points. Now, I've treated him 4 times now. And so not every single treatment am I hitting the exact same motor points. We're identifying and assessing with hands-on palpation what areas need the trigger point, motor point work, what areas do not. Twi-Na to harmonize the treatment after the motor points are pulled. So we want to just somewhat give the tissue a little TLC, a little hands-on work. I like the idea of cupping his posterior shoulder, help create space through that strained tissue that has been pulled into a long and intense position, while I'm gua shaing the anterior shoulder, helping to open up that anterior shoulder and having him go through range of motion with both of those. There's a whole bunch of great chats that I'm excited to go back into and hit up, including the sport history. Foundation training. I don't know if you guys are specifically in tune with what foundation training is offering. I highly recommend it for all TCM practitioners. It is about creating space and decompression for the axial skeleton. It increases stability, decompresses the spine powerfully, gives hip stability a whole new meaning. And it really is profound in the breath work that I do. So I prescribed that right away. They have foundation training streaming site that I recommend to my patients commonly. I get them being able to follow along and initiate their foundation training after their first visit, because I take them through what decompression breathing looks like in about 4 minutes. And they can carry on with the first week of training by themselves at home. And then we're able to fine tune it on their next visit. I prescribed a breath belt. The breath belt is a incredible device developed by a former NFL kicker. His name's Jesse Oliger. This guy realized that we don't train our breathing patterns very effectively. So this is a resistance trainer for your diaphragm. It's a resistance trainer for your breath pattern. It increases the posterior rib cage expansion really powerfully the way I use it. It also can be a trigger point release for the psoas and lower abdominals, creating space between your ribs and your hips. It's a fantastic device. I highly recommend that as well. Got him into Egoscue therapy right after that. So Egoscue therapy is going to more specifically look just at his postural imbalances and personalize his recommendations to put him in a different or better start position to move from. So these are the exercises I prescribed for him: standing arm circles, gravity drop, cats and dogs. You'll notice that it's a combination of a lot of hip stuff with shoulder work. Breathing throughout, combining the therapies of foundation training and Egoscue is something I will do pretty much with every session. Notice he is wearing the breath belt with certain exercises. The standing arm circles and gravity drop for sure. I also have him using the breath belt in floor block and sitting femur rotations. Herbs and nutrients. I prescribed Juan Bitang to help modify his pain symptoms. Also has a nice little tonification for his blood. And then I use a lot of nutraceuticals in functional medicine type of recommendations. So I use Zymogen's nutraceutical line. I use a product called DHQ. I've gotten amazing success using this. Well, you'll see the herbs that are listed there in DHQ for sinus congestion, low-grade inflammation that presents itself as an allergy type of symptom. Works on many different aspects of that. Monoglyceride form of omega-3 called Monopure 1300. I'm a huge fan of fish oil. Actually, fish oil and turmeric, Monopure and Kirkiplex 95. I call them my two little Swiss Army knives. They fit into almost every indication you can imagine. And I commonly am using those as baseline recommendations. And I wanted to increase his magnesium, help support his adrenal glands. I went back and forth on this part, honestly, to determine, do I want to do more adrenal support, more calming, more tonifying? And what I chose to do in the first stages is Optimag 125. It's magnesium chelate. But I do plan on alternating this with a magnesium L-threonate to help cross the blood-brain barrier. If you do have more questions on any of that stuff, email me and I will get you info on it. CBD, chrysanthemum, and chamomile teas were recommended in the evening, help calm his nervous system down. Lifestyle recommendations: breath work, nostril sets especially. That's where we started. Want him breathing in and out of his nose, helping to move qi through that congested tissue. Nostril sets also have powerful vagal nerve toning aspects. They are calming, relaxing, nourishing. So as he's doing his meditation, he's focusing on nostril breathing. I also want him alternating nostril breath. So he's clogging one nostril as he inhales, switching, exhale, inhale, switching, exhale. Wonderful thing to do, especially before bed. Another nostril or breath work component that I highly recommend for him is inhaling deeply, plugging his nose, going through neck range of motion in each direction, helps to drain the sinuses. This, for someone that's just congested, especially in this time in our COVID-19 battle, if you are feeling some sinus congestion, and you can do this to help try to drain that. And it's actually great to do even with Bitong and other Yintong, other sinus points. I highly recommended him doing postural resets between his workouts. I know this guy. I know he's not going to stop working out. As soon as he has, enough relief to push it hard, even in exercises I'm suggesting he holds off on, he's going to do it. And so I gave him postural resets to do between and before specific exercises, so that he is putting his body in the best position to work from. Mouth taping with Somnifix. Somnifix is something I recommend for many people. Now, this is a tough one for him, and I'm not recommending he goes too quick out of the gates, given that he's already having trouble sleeping. But Somnifix is mouth tape designed with a little small hole. It's basically the same size of a single nostril at the mouth, so that you aren't mouth open, jaw dropped, snoring, and becoming affected with dry mouth. Somnifix is a great product that I have gotten wonderful results with. And then, of course, additional lymphatic techniques we don't have time to get into today. And so this is my email address. I want to take some questions and get into some of the chat components for the last few minutes here. Hope I didn't go too fast, but let's get into some of these. All right. His breathing, could I share how his breathing, is his breathing at all, how this could affect his condition? Absolutely. So talking more about breath, if you are congested, you have a tendency to become more of a mouth breather. You have a tendency to become more of a scaling breather as well. Think of if someone just covered your nose and mouth and made you kind of panic, just as in terms of representing a mild stress. As you let go of that, you're most commonly going to be breathing in a stressful pattern. And I believe that is an over-exaggeration of what he does on a regular breath pattern. He is breathing upward primarily here, rather than into his back, spreading his shoulder blades wide as he breathes and creating space both in the front and the back. He is more elevating and extending. That is going to put a ton of stress and strain on the brachial plexus, thoracic outlet tissues. So yes, absolutely affecting his shoulder pain. Combo that with, why is the shoulder pain happening on one side? Yes, it could be an old injury. It could be adding to some tension that was already there from his old slip and fall on ice. But he also has this posture that is going to focus that same breath pattern more severely on one side than another. Yoga chest openers are awesome. There are so many great exercises. And so use what you know and add an exercise to complement your hands-on therapy to help change the outcome of the therapy longer. Where do you learn about breathwork therapies? I mentioned foundation training. I think they have a wonderful framework that is posture, stability, and breathwork combinations. There are a ton of other great sources on breath. The Oxygen Advantage is a great book you can take a look at. Chronic sinusitis, bad during sleep, use Flonase. I'm not sure what the question is on that. I could see that causing a kind of a mini panic attack. Absolutely. If you think of chronic stress, impaired breathing patterns, I think, are one of the easiest ways to develop chronic stress patterns, both functional patterns and emotional stress patterns. And that, in my opinion, I think I would have PTSD if I felt like I couldn't breathe. I felt like I was suffocating while I sleep. Definitely doesn't encourage nourishing, regenerating sleep patterns. I did not say anything about him having asthma. He did not report having any asthma in his health history, just chronic rhinitis sinusitis. His father had asthmatic COPD. What you saw asthma in this was from his father's family history. Would I talk more about light therapy, especially over the cerebellum, please? Sure. So our light therapy over cerebellum will help to stimulate that portion of the brain. Something interesting, I know a lot more evidence needs to happen in the aspects of light therapy, laser therapy, photobiomodulation. There's so many different names for some of these types of sciences. But we know that photons penetrate the skull and increase function to the nerves of the brain. We can see that on functional MRI. We can see cerebral vascular changes on functional MRI with laser over that. And it actually goes into the tissue and kind of bleeds. The way I describe it to my patients, this is not a claim, but the way I envision it and describe it is that water on a paper towel, the way it spreads. Lasering one lobe of the brain changes the cerebral spinal fluid and the ionic changes, the blood flow changes to other lobes of the brain. They're doing some really interesting things with light therapy on the skull for autism, for Parkinson's. They're doing some really cool things. Dementia, which I think is a huge topic that needs to be addressed from our perspective. TCM practitioners, I think, are a huge solution to our potential dementia issue in the near future. And so as we are patterning new movement changes, lasering over the cerebellum is something that is really effective. Occiput, cerebellum, motor line. Those are 3 areas that I will hit up at the end of the treatment to make it last longer. Let's see. Jack, if you have any specific questions in here that I have missed because I was talking quite a bit.
Looks like Pachi's asked for the name of the program you're using again for the postural alignment. I'm not sure if she was referring to foundation training or Egoscue, but you can more information about that.
The program is EPEAT from Egoscue. That's what in SMAC, it was very visual, but the program is very objective. I love SMAC's stuff. I think I highly recommend it. I think that's a great place to also learn not only diagnostics, but treatment, breath work. So many different aspects of our therapy are addressed in Matt's work through SMAC. Fascial trains during Chi. It's his lats, his lat QL component. I don't know if it's stronger. I totally understand what you're saying, but in a lot of his movements, I think there's a difference in length and tension relationship versus strength. He's actually very strong on both sides, but the position that he operates from is shorter on one side. So that's something interesting to further dive into, and I'm planning on taking some videos of him doing pull-ups, push-ups, and a number of other exercises. And I'll probably be using this. This is just a kind of an insight into, I'm going to be working with Jack, Lord willing, at the Pacific Symposium on a 2-day pre-event of putting all these puzzle pieces together. How do we work with multiple modalities in single visits and on our patients? How do we pick and choose? And so I'm going to be presenting how we move through all this. And this is going to be one of the cases probably that we will have the opportunity to revisit with much more information as I'm actually continuing to work with him. Can you provide a reference?
I think Susan also asked what your prognosis, if you had any way to estimate a recovery time.
Great question. With his overhead motion, he's already showing great improvement. He's getting great responses to treatment, and about half of the results, about 50% of the improvement, is lasting between treatments. And that is without him being consistent with his exercises yet. He's admitting that he has done his breath belt inconsistently. He has not done his foundation. He's on day 3 because I'm cracking the whip on his foundation training. He should have been on he should have been about 2 weeks in. His Egoscue, he's slowly just adding in. So this is early on. I know once he starts doing his exercise therapy, we're going to have a clear picture. He's going to most likely progress into having little to no pain probably in about 4 weeks in terms of full internal rotation, as long as we get the adhesions and the anterior pec. That's my wild card. That's what I don't know. As far as how fast his adhesions and his lockdown anterior shoulder is going to function. His breath work has changed dramatically though, and as he breathes differently, he is connecting that to functional changes real quick. Can I provide a reference to find out more information on light therapy? Yes, email me and I'm happy to get you all sorts of awesome information on light therapy. I'm a huge fan and I've got some fun resources on that. Do I explore food allergies and food sensitivities? Yes, he actually did present some old tests of food allergies, nothing real severe. He actually was very low on his allergy to the grass and the dust mites and things like that, the traditional stuff. But I do love taking in information from food allergies, sensitivities. What about the issue with his pelvic movements helping the shoulder tension? I feel like I answered that to a degree. It's a big topic. We're going to dive much deeper into that in a 2-day seminar, but the pelvis connects to the shoulder directly, crossing pattern through the lat and QL, linearly through the anterior chain. So look at your fascial trains, your anatomy trains by Thomas Myers, and you'll identify some of that. So I love testing pelvic stability for shoulder imbalances and vice versa. Shoulder, low back, hip issues, test shoulder stability and see if the aspects change, and always test your breathing, because the breath work, the diaphragm and axial skeleton stability is what I would call the linchpin between the upper limb and lower limb. If we are engaging our diaphragm as a chronic stabilizer, you are not going to get proper expansion through the chest. You're going to get a ton of compression, and we all of a sudden start to compensate and move incorrectly. You have to be an Egoscue trainer to get access to EPEAT? That is a good question for Egoscue. I believe you have to at least be a student, but they do actually offer, if you're looking for people to prescribe your patients posture therapy and you don't want to do it yourself, you're too busy, Egoscue has some great solutions for that. You can contact Katie at Egoscue University, or Brian Bradley mentioned to me that that's something he wants to be able to help more with, because I think it's a great need that is not utilized as much as it should. Egoscue training is awesome though. Highly recommend going through their certification. And they offer it online. And right now, with our current times, it's not a bad time to get out there. If you let them know I sent you, they are supposed to give you a discount. That's what they said. Does caffeine intake impact your treatment with them? I have not noticed that. Other questions? I did not get any DEXA MRI or x-rays. Good question. I'd love to see those. With movement towards hands-off treatment lately, what sort of compliance are you getting in general with patients in this time of telemedicine? Awesome compliance. It's kind of locked people into actually doing their therapy. And so I offer my posture therapy, my breath work, my, nutritional recommendations, of course, herbal consults, and lifestyle recommendations, all via telemedicine. Do I do Moxa on him? I'm a huge fan of Moxa. I honestly use laser instead of Moxa. It has an interesting connection and similarity. The wavelengths that Moxa emits and the type of photon emission that Moxa has, between 400 and 1,000 nanometers, majority of the SpectraCell type of emission. And so the laser allows you to customize or become more pinpointed, specific to what frequencies you're looking for in terms of warming, cooling, activation, the most therapeutic type of wavelengths. And then you can also add to the benefit with frequency-driven information into the nervous system. So you can customize the frequencies of light emission to focus it more on muscle spasm relief, neurological activation, pain and inflammation, lymphatics, neuropathy, a number of different things. I use Erconia's laser. This is my EVRL. I'm a huge fan of their whole line, but in this time of viral loads and immune compromise, I'm a huge fan of the EVRL. It has a violet laser that helps to work on immune function and antimicrobial in effect. One other aspect on that antimicrobial effect, there is something called active skin repair. This is something totally off topic. I've used it for a long time to be my kind of go-to travel companion. I travel to Fiji and work with a lot of surfers that cut themselves like crazy. It's known in the action sports industry as a wonderful topical for wound care. But this hypochlorous acid is also being used as an antiseptic in hospitals. It's being used on cruise ships, from what I hear. They're switching over their cleaning solutions to this instead. And Dr. Klingart is put out an amazing video. If you want that access to the video, email me. He has some herbal recommendations and other things, but he presented on how effective this has been in other past infections of the human coronavirus. And it is something that is incredibly safe. It comes in a spray or a gel. We're always concerned about washing our hands these days, and don't touch your face, right? And so you can use this as a hand sanitizer to a degree, but it is safe in your eyes and your mouth. You can use it in other areas with great effects. And he presented an interesting study that I'm reading currently about the effects of this hypochlorous acid as a throat spray with propolis. And interesting effects. I think it's a wonderful solution. It doesn't kill your friendly bacteria, from my understanding. Active skin repair. Yeah, it is an awesome, awesome product. If you go online or email me, I can put you in contact to getting that easily. And I think it's something that all of our patients are going to love to use. I use it on my table as a cleaning solution. I spray my patients' ears and face after I'm working on their neck and things like that. It is a fantastic product. Egoscue, Thomas Myers, TCM, foundation training, any other major thoughts, teachers you follow, recommend Matt Callison for sure. He's fantastic. In terms of the laser therapy side of things, there are some great educators that teach on behalf of Zirconia. Trevor Berry is fantastic. Does it come by the gallon, Greg? That's a good question for Jason, the owner of this company. He is a really cool guy. He actually lives in PV. Awesome surfer and great, great guy. I want to see this company do really well. I have the studies on the active ingredient in this as well. I'm expecting a ton of emails. If you guys want this information, I'm happy to provide it. I have some emails already organized. I won't be able to get to those for about 5 hours, but I'm happy to jump back into those later. And so Dr. Trevor Berry is another one I mentioned. Name of the topical.
About the Pettibon training that you've done.
Oh yeah, Dr. Bro Pettibon was a very influential man in my life. He is a chiropractor, educator, or was, rest in peace. He passed a few years back. He still has some wonderful educational opportunities and things like that. Dr. Pettibon specializes in spine-focused rehab. And so he has cervical traction units and proper training on how to use those, how to rehabilitate and rehydrate the discs. Wobble chair is actually a chair that I'm sitting on just for right now. It's not my normal desk chair, but the wobble chair is fantastic. You can look those up. Those are two wonderful pieces of equipment that I very commonly use. He also is well known for posture corrective therapies using head, shoulder, and hip harnesses, where you weight the body to offset the imbalances. So if you have a really low right shoulder, you weight that shoulder and you start to engage the opposite side to restore posture equality. It works incredibly well. It needs a lot of x-ray support. And so I used to work in my dad's office. He's a chiropractor and acupuncturist as well. And he had access to a x-ray machine. So we were able to identify more specifically what was effective. And so since I've pulled away from using x-ray as much, I have pulled away from using as much of the hip, shoulder, and head weights. But it's a fantastic therapy. I think collaborating with Pettibon practitioners is a wise thing to do. They're great with their understanding of the nervous system and posture.
So Dustin, I think we probably need to wrap it up. I will circle up with my marketing department to see if when we post the video on our blog and YouTube channel, if we can also post the PDF that you have, if that's possible, or any other links that you want to provide to us. I think people are asking for, references for some of the things that you've mentioned, so that might be helpful. Yeah, I mean, man, thanks again for doing this. It was so informative. It's a bit like drinking from a fire hose. You got so much information. And as you mentioned, you will be doing a 2-day workshop at Symposium in October, November, as long as our current situation improves, which we certainly all hope for.
Yeah.
Yeah, thanks a lot. Thanks to Matt, also Matt Callison, for providing some of the slides that you used. His book is obviously beautiful, and I agree with you, every acupuncturist should have it.
Sure.
Yeah, our next master class will be this Thursday with Jake Fratkins at same time, so 11 o'clock Pacific time, 8 a.m. Hawaiian Aleutians time. Yeah, thanks everybody for coming. This was so great to see you all here. Again, Justin, thanks a million, and we'll stay in touch.
It's my pleasure. And everybody, use the time that you have, that you've been blessed with, hopefully in good health, to better yourself, and know that you're already an expert. You already know this stuff really well. Use what you have. And I hope this just helped you kind of think a little outside the box. Excited to continue this.
Very thought-provoking. Thanks again. Bye, everybody.
Bye.